Hello, welcome to the second video in our Future Learn course, Thinking Like a Health Economist. My name is Professor Darren Baines. In this short video, we will introduce the concepts of decision making and uncertainty, which are central to the thinking of health economists. In order to allocate scarce resources and to make patients better, clinicians must make decisions. For instance, if there's an expensive new drug, an insurance company or a public healthcare system like the UK's NHS must decide whether that drug should be available. And that decision will be based upon a number of factors. But from an economic perspective, the key factor of whether that drug should be available is its cost effectiveness. If the drug produces more benefits than the costs expended, we can say that that drug is efficient. Therefore, central to the thinking of health economists is the notion of decision making and how we make choices about what care patients should receive. The interesting thing about decisions is that although we make them every day of our lives and we make thousands upon thousands of decisions, we're not always sure that we've done the right thing. For an economist, we could say that there's uncertainty because we're not always certain about whether we've made the right choice. For example, if you go shopping and you buy yourself an expensive item, you may say, I wonder if the benefits outweigh the costs. Every day human beings make decisions about what to consume. For instance, if you go to the shops and buy an expensive item, you may ask yourself, I wonder if the benefits outweigh the costs. For an economist, you are only rational if the expected benefits you derive from consumption are greater or equal to the costs that you expend. Therefore, applying the logic of economics to a healthcare setting, health economists are interested in how we make decisions. In particular, they're interested in promoting rational decision making where the benefits outweigh the costs. We shall look at decision making in the first section now. Economics is the science of decision making. When people choose, they select the alternative available to them that they prefer. For instance, a doctor can choose drug A, drug B, surgery or physiotherapy for a patient in pain. Alternatives have their own costs and benefits. For instance, a doctor could choose the most beneficial option for a patient regardless of the costs. In other words, the most effective alternative. In contrast, health economists argue that we should choose the most cost-effective option. For instance, an option that maximises health gain for a particular level of cost, or alternatively, for a given amount of health gain that minimises the cost to the health system. Because we cannot know actual costs and benefits in advance, economists always work with expected costs and benefits in their calculations. With expectations, we cannot be certain. Therefore, economists always talk about decision making under uncertainty. As you can see, health economists are interested in efficiency and promoting decision making where the value of the benefits outweighs the value of the costs. However, as we'll see in the next section, we can't always be certain about our choices. So a key concept in health economics is uncertainty. Health economists build models that are abstract representations of real decision-making processes. For instance, we can model the costs and benefits of diabetes care. Health economics models have a structure as well as parameters that reflect costs and benefits. The analysis is based upon point estimates of costs and benefits, which give precise figures for these variables. This type of work is referred to as deterministic analysis. The decision whether an intervention is cost effective or not should be based upon deterministic analysis. However, we need to know how confident we can be in our results. To test reliability, we need to measure the uncertainty surrounding our results. The main forms of uncertainty in health economics are structural and parameter uncertainty. When we measure uncertainty in our work, this is referred to as stochastic analysis. When health economists perform their analysis, they take two stages into account. Firstly, they treat the choices as if we're certain. They look at the expected costs and benefits and weigh them up without any uncertainty. They say this is the answer. Once they've done their deterministic analysis, health economists then say, I wonder how certain we can be in our conclusions and our estimates and our models. And that's called stochastic analysis. Health economists therefore think that decisions should be made using certainty, but our degree of belief or our uncertainty should also be measured, because we could expect something to happen, but there could be lots of variation around that. That means in practice, after the decision is made, that outcome doesn't occur. Therefore, health economists make decisions based upon expectations, but they're also acutely aware that when applied in practice, what they predict is very unlikely to be 100% true. And there will be some uncertainty or difference between the expected values of costs and benefits and the actual benefits and costs that patients accrue. Therefore, to conclude, decision making and uncertainty underpins the thinking of the whole of the health economics profession.